Welcome to Doctors on Call. I'm Jenna Miller. Pets provide many physical and emotional benefits to their owners or guardians, and there are many things you can learn from your pets, such as taking naps, go for a walk, enjoy the outdoors, be silly, and drink water when you're thirsty. With spring approaching, what should you do to maintain your pet's health and safety? Joining us tonight to answer your questions about your pet's health will be Dr. Katrin Kilder.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Neighbors, friends. Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Katrin Kilder was born in Atlanta, Georgia, and moved to Iowa in 1968. There she graduated from Iowa State University Veterinary College in 1983. Dr. Kilder owned practices in Iowa and Wyoming until 2010. Most of her career has been spent in general small animal practice. Dr. Kilder enjoys helping clients solve their animals' special issues. Routine soft tissue surgery, dermatology, internal medicine, dentistry, and preventative medicine are her favorite subjects. She currently works part-time in Hayes, Hoisington, and also in Russell. Give us a call at 1-800-337-4788 toll-free with your questions about your pet's health on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Thanks so much for joining us, Dr. Kilder. We're going to start with some of our questions while we wait for those calls to come in. First of all, how often should you take your pet to the vet?
It depends on the type of pet you have, the health of the pet, the age of the pet. Initially, we see pets when they're puppies, kittens, every 3 weeks. Just like babies, they need to get initial vaccinations, they need to get booster vaccinations, have stools checked for parasites, and then we talk to them about behavior, because starting your pet out right when it's young is often the best way to avoid problems in the future, like separation anxiety or behavioral issues that can be nipped in the bud when you start young. So twice a year for a healthy regular pet, sometimes once a year. And then as they get older again, we need to see them more often, just like we have more problems as we age. We see more issues that, again, if we catch them early, we can make changes in diet, changes with medication, so that we can help your pet live longer and healthier.
Okay. You bring up an interesting topic of separation anxiety. Let's talk about how we do nip that in the bud, especially where people aren't home, very often, maybe during the day.
It's a good question, and it's a very difficult topic or difficult problem to solve without working together with often medication, a plan of changing the routine at home, and sometimes even using an animal trainer or a behaviorist. But again, starting young, training your pet to use a crate while you're gone so that the animal's not destructive, not over babying the animal when it's first with you so that it never is alone. It never learns to calm itself. It always thinks it needs somebody with them. Once those behaviors start, then we usually use an anti-anxiety or antidepressant medication along with changes like putting your keys in your hand, putting your coat on, and then going to sit down in your chair. And changing things up so that the pet doesn't get so geared to those little clues that I'm going to be left alone and I'm going to panic. And then extending those times that you're gone for maybe just a minute or two, then back, and just helping the pet to understand that it's going to be all right. Leaving a radio on. I don't think getting a second pet is a solution if you're already having problems with one pet, but it is difficult, and it takes time and real commitment from the owner and the veterinarian.
And what might a person consider when making the decision to get a new pet?
A new pet, if you have always had an animal and you've maybe lost an animal, or if you have space and time and you think that your pet would enjoy a companion, if you have the room and the finances and the time to spend with a pet, because often the second one gets kind of shorted in the training, kind of like our second and third children don't have a very big baby book because we get busy, and then we kind of presume that pet will learn from the other one, and it may not have the best behavior because it doesn't have time. So, if we have a life change, if we retire, if we're more homebound, then certainly a companion, whether it's a cat or a dog or a rabbit, and often there are wonderful shelters and rescues that have pets that are maybe a little older, that would be better for people that are a little older, so that they can not have the puppy problems, the destructiveness, the high vet bills often at the beginning when the dog eats the laundry or the cat swallows the string or something because they're young and a little bit get in trouble. So it just depends on where you are in life, and that you go into it knowing it's a commitment for sometimes 10 or 15 years, and that it's not a disposable, quick emotional decision to make.
Absolutely. Okay, good advice. We're going to go to the phone lines now.
Great.
We've got a caller waiting to ask a question from Medicine Lodge. Go ahead with your question for Dr. Katrin Kilder.
Yes, I have a 1-year-old pup that doesn't seem to be putting on weight. Now she's seems healthy otherwise, and she's got free reign of food anytime through the day, but I just feel like she's under her ribs. She just doesn't seem to be putting on the weight like I feel like she should. Do you have any advice for me?
Sure. How old is this? I'm sorry, you said just under a year. What breed is it?
A black lab.
A black lab. Well, in about 3 years, your veterinarian will likely be saying to you, please cut back on the nutrition because your dog is overweight. And has she been spayed yet?
Oh, she's not on the line anymore.
Oh,
Sorry.
okay. So if the dog is a year old and she's not spayed yet, that's a normal, healthy thing. I mean, when we look at our kids or remember what we looked like when we were 8 to 10 years old and riding our bikes everywhere and active, we were all string beans. And so that's a good thing. I like to see dogs that are slim. Obviously, if she has chronic diarrhea, but you say she's healthy, you've probably had a stool checked for worms. If you can free feed a dog, that's kind of unusual. As they get older, you usually have to limit feed them. So make sure it's a good quality food, not a corn-based food like many of them have corn as an initial ingredient. But if the dog feels good, she has no neurologic problems, meaning she doesn't get depressed when she eats, she doesn't have seizures, which could indicate a very unusual abnormality of the liver in a young dog. But as long as she's happy and active and stools are normal, I wouldn't worry about it. And once you get her spayed, especially, they tend to put on weight, and as they age, they put on weight. And in that case, you want to keep her limited so that you can feel ribs without pushing, and you want to make sure that she maintains her waistline so that she doesn't get hip dysplasia and arthritis, knee problems. All those occur in labs that gain too much weight. So enjoy it now.
Now, how do you know what kind of, there's so many different kind of pet foods out there. How do you know when you're getting a good quality pet food?
It's not always you get what you pay for, which a lot of people think if they pay $60 or $70 for a big bag of dog food, or that it's grain-free, that you're getting the best thing. Sometimes actually those very high-end foods are too high in protein, too high in fat, and they can actually cause kidney problems if a dog doesn't really get a lot of exercise, burn a lot of energy like a hunting dog. It can be a burden on the dog. And if it's high in fat, then you can end up with a dog that's overweight. So I think that reading the ingredients, I prefer dog foods that the first ingredients are not corn, whole ground corn, corn gluten meal. I prefer, if it's going to be chicken, it says just chicken rather than chicken byproduct. because byproduct is generally feet, heads, necks, things that are not really high quality protein. So you want to look for something that says chicken or chicken meal, which is better again than byproducts. And if you have corn, have it 3 or 4 down, preferably. There are some reasonably priced foods, if you really do study and ask your veterinarian for a recommendation that doesn't have a lot of grain, because I find that corn, especially wheat, can trigger ear infections, itchy skin, things like that, which are huge problems with dogs.
Okay, now we're getting into the spring months and it's starting to get warmer outside. Let's talk about some of those things that we need to be precautious about with our pets.
Sure, Jenna. Spring, it's finally here, thank goodness. But also we can see the mosquitoes buzzing around in the air, and I've already seen one dog with ticks in his ears and shaking his head, and you think, oh, it's an ear infection. I put my scope and they're crawling around inside of the ear, and I'm like, wow, I haven't seen those in really a long time. And it was like a week after we just had a blizzard. So I think we all need to get to our veterinarians and get a good quality flea and tick product. We have many new products out, and your veterinarian generally is going to have the newest, safest, most effective products. Now we're using an oral medication for fleas and ticks so that you don't have to squirt that chemical on your pet, which leaves an oily spot. And if you have young children, I don't really like that around young kids that put their hands in their mouth. So I think it's a good idea to start flea and tick preventative. Heartworm, not a real huge problem in Kansas, but getting to be more and more so, and that's transmitted by mosquitoes. So if your neighbor has a dog that is positive for heartworm, let's say they adopted a dog from Texas, from Hurricane Katrina, or from another rescue and brought this dog up, the mosquito bites their dog, then it bites your dog, and it develops a fatal infection with heartworms, which grow in the heart and lungs and which cause heart failure and death of the dog. So spring is a good time to booster the vaccinations. Everything is more active. There more exposure. You see skunks all over. Your pets can get more contact with feral animals because you're out a lot more. So it's a good time to booster the vaccinations and get them on a preventative and get them a haircut so they don't get full of burrs and you can find the ticks more readily. But those are the biggies for spring.
Okay, now you mentioned skunks. We know there's a lot of people that are having their dogs that are sprayed by skunks. What do you do? There's some old wives' tales out there, but let's set the record straight. What can you do?
Well, I don't know the recipe by heart, but you can Google it, and it involves hydrogen peroxide and Dawn dish soap and baking soda. And tomato juice is effective. So if you get a big can of tomato juice, the acid will help to neutralize the smell somewhat. But it's not only the smell. If a dog actually gets sprayed in the face, they can burn the eyes. And if they take real direct hit, they can almost get a reaction to that strong, powerful scent. So there again, having the rabies shot up to date is very important, and just making sure that you keep them out of the house and bathe them right away, usually a couple of times to get the smell down.
Absolutely. Now, how much water? We're also with the warmer months. How much water is enough for your pet? Should they have access to water at all times?
Generally, yes. Fresh water available indoors, outdoors is a good idea. I don't really like to put food out because it will draw those kind of animals, the raccoons, the skunks, things like that. The rule of thumb is 1 ounce per pound of weight. So if your dog is 8 pounds, it should drink about 1 cup of water a day. Obviously, when the weather gets hot, those requirements go up dramatically. So you need to make sure that when it's hot, your pet always has fresh water and that it's not stagnant, full of bugs, algae, that type of thing. We actually have some problems in Kansas with algae in the lakes when it gets really warm in like August and September, when the lake temperatures have been going up, and those can actually cause liver toxicity and be fatal. So be very careful, and if there are warnings for a lake, do not take your swimming dog to those lakes.
And how do you feel about bringing your dog in, even if it's an outdoor dog or cat? How do you feel about bringing them in when it gets to be the real hot summer months?
I think it's a good idea because heat stroke is one of the most devastating ways to lose a pet. So we should all know and be aware of, you never leave a dog in a hot car, not even with the window cracked down. Even if it's 70 degrees, if the sun's shining in, that car quickly will go to 90 and 100 degrees. And it's completely preventable, and your dog does not need to go to the grocery store. It does not need to take that little trip if you're going to be out of your car. When you do bring a pet in, you want to be careful you don't bring any friends with the pet, so you want to make sure that that outdoor dog or outdoor cat especially, a lot of outdoor cats routinely have fleas because they hunt, and so they get near those rabbits or those mice, and the mice have fleas and jump on the animal when they're being eaten, and then they'll bring fleas in your house, and that's one of the worst things to try to deal with, is a house full of fleas. So make sure that they're protected against fleas and ticks, and give them a haircut if they're a dense coated dog that can be groomed, and maybe not bring them into 70 degrees and then expect them to live outside right away. So bring them into a garage that's cool or something like that, or if they're an indoor-outdoor dog, it's fine.
Okay. And what happens if you unfortunately do get an infestation of fleas in your house? What can a person do?
Well, you can call an exterminator, and they will come and spray. You want to make sure and go to your veterinarian and get at least a 3-month supply of the best quality flea control medication you can give, and you need to treat every animal in the house. You can't just treat the dog or just treat the cat. It has to be every animal that comes in the house. And the reason you have to treat for 90 days is that there are going to be eggs that roll off the pet from the fleas that bite the dog and then lay eggs, and those eggs will roll into your couch cushions and the baseboards, into your wooden floor crevices, and those eggs will hatch with the right temperature and humidity and make new fleas. And so it is never going to be a one-time, I'm going to spend $500 and spray everything and kill everything, because you're still going to have eggs hatch. So you have to kind of stick with it, do a lot of thorough cleaning, vacuuming, getting rid of the vacuum bag. It's just something you have to deal with. And the other thing to remember is at the end of those 90 days, we strongly recommend 1 to 2 tapeworm treatments, because fleas transmit tapeworms to your pet, and tapeworms are contagious to humans. So when the dog or cat licks itself, it swallows the flea, and then that turns into a tapeworm inside. So they're the intermediate host. So you definitely want to worm them after they've had fleas, because those are gross.
Sure. Now, do you recommend pet owners give their pets flea and tick treatments? You said the oral pill earlier, throughout the winter months as well, or should they just do that through the spring and summer?
It's a good question. When I lived in Iowa, it was pretty much all year round. We're a little bit higher and drier, but we really have had previously very mild winters. This has been one of the coldest winters that really will interrupt, 10 below zero will interrupt the life cycle. But pretty quickly, we're back into the 70s, and so if you want to be 100% sure, rather than having to spend all that money and fight the fleas in your house, it's probably best to keep them on year-round, especially if you have, any wildlife around, rabbits, squirrels in your yard. They're going to bring in fleas. If your dog is going to be around other dogs, if you go to the dog park where there's exposure and you don't know what these other dogs have, then you're pretty sure that you're going to pick up fleas.
Okay. What shots do you recommend for your pet?
That's a really good question, and it really depends on the animal, on the animal's exposure, on the animal's age, on the animal's health. The basic vaccinations for cats and dogs are the distemper and the rabies. And then we have hunting dogs that I would recommend the lepto vaccine, or farm dogs, the lepto vaccine. Leptospirosis may be familiar to cattle clients more than it is to dog and cat dog owners especially. There are lots of different vaccinations. Kennel cough, if you're going to board your dog, we recommend that. It's an upper respiratory virus that they can get when they're around a lot of dogs. So if they go to the dog park, they should definitely have the kennel cough vaccination as well. There's an influenza vaccine. There have been outbreaks in bigger cities of influenza, so doggy flu. fairly serious, but only to a small portion of the dogs. And there is a vaccine, but unfortunately, just like in humans, the strain of influenza changes, so the vaccine has to change. So the one vaccine 1 year may not protect against next year. And then, puppies need boosters, 3 vaccinations in a series at least. Same thing with kittens, 2 to 3 vaccinations of their distemper. And then usually annually rabies. Some people will give a 3-year rabies, but we want to make sure that we're staying on time and that the dogs have had their 1-year rabies first. And older pets or purebred animals that have things like allergies, severe allergies, I recommend less frequent vaccinations. Older animals that have things like kidney failure or cancer, then certainly I would go every 3 years as the rabies is allowed, and then often the distemper as well, just because that animal cannot stand the immunologic challenge of a vaccination.
Sure. We want to remind our viewers that we're talking about pet health tonight with Dr. Katrin Kilder. If you want to give us a call with your pet health question at 800-337-4788, she would be happy to answer your question. We're talking about different diseases, I guess, if you will, but can people catch diseases from their pets?
Yes, they can. And leptospirosis is one of those that we really need to be careful of, both in the clinic and at home. So when a dog might come in with some vague symptoms like a fever, vomiting, maybe diarrhea, not feeling well, that we take precautions to try to prevent ourselves and our staff and then the family from being exposed potentially to a disease that is zoonotic. Zoonotic means it can infect humans as well as animals. So that's a big one where we want to wear gloves. The secretions of the animal, specifically urine, because it can be in the kidneys, or even saliva, can infect humans. And it's a disease that your doctor wouldn't think about if you didn't tell him, hey, my dog's been at the vet and it's sick, and they're trying to figure out what's going on. So it can do a lot of damage. It can end up in kidney failure or even death, so if it's not treated correctly. So there certainly are diseases. Parasites, I am a very big proponent of deworming animals. Cats, dogs, especially through their young time, because roundworms are contagious to children. Ringworm is contagious, but it's generally just little red spots, and I had it lots of times when I was a kid playing with the neighbor's cats. There are many diseases like salmonella that can be contagious. Brucellosis, which is more of a cattle disease, but there's also a dog brucellosis. So there's good reason not to really be quite intimate with your animal. A lot of people put them in their bed and they kiss them a lot, and dogs' mouths are fairly healthy, but when you've seen one eating the cow poop or anything else, the dead raccoon, it's probably best not to do it.
Gotcha. Okay. Now, how important is it to keep your dog or cat well groomed?
It depends on the animal. Certain breeds, as a matter of fact, I spent about an hour and a half combing out my border collie this afternoon because it's windy and then all the hair gets blown away and the birds can make a nest. So it is important to keep mats under control, because the mats can get tight down to the skin and then they can trap moisture. And so we'll start to see in July and August some of these Great Pyrenees dogs or collies that undercoat has not been combed out, and they get mats, and then they either lay in the mud where it's cool because it's hot out, and they develop hot spots where they get a staph infection under the skin, and then that attracts flies, and then they get maggots. And it's a terrible thing because you can't really see it from the outside. Maybe the dog just hides under the porch and it just won't come out and it won't eat, and you bring it in and you start shaving and you just see all these maggots, and it can kill them because they can go inside. And so it is important that the hair is combed out, whatever the breed is. There are some breeds that really should not be shaved, like Huskies. That's just not the kind of hair coat, so you really have to comb out the hair coat. Same thing with long-haired cats. You need to keep those mats combed out. If you need to shave a cat, often you need to sedate it because they don't really like it. But, the small breed dogs, the hair gets tangled. They'll come in sometimes even where they can't poop because they've allowed the hair to get very long and they can't really see back there, and it just slowly gets hard in there, and they just don't feel right. Usually, though, the smell is a dead giveaway that there's a problem. So it is important. It doesn't have to be done every 8 weeks unless the dog is prone to matting or fecal impaction, things like that. So it just ask your veterinarian. They usually have a groomer on staff or they work with a groomer, and they can help you, and you can learn a lot yourself of how to do it.
Okay.
Yeah.
Thank you so much for being our guest tonight. We
Sure.
appreciate it. Dr. Katrin Kilder. We were talking about pet health tonight. Next week on Doctors on Call, our topic will be cancer survivorship. You can email questions to us for our next program at the Smoky Hills Public Television website or directly to the address doctors@shptv.org by Tuesday at noon. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.